Might as well start,
What do you?
6:30, so.
You don't have to
It's
do
about-
any. You said
My name is Nick
something
Toscano.
Well,
I'm a licensed insurance agent, and I've been been involved in insurance about 35 years. I've been working on Medicare for the last 8 years, and I consider myself to be a Medicare specialist. This seminar is going to be strictly educational. I'm not going to discuss any product itself. If you want to set up a time after the meeting, either here or at your home or at another place, that's fine. When I go right through the booklet slowly, and I invite you to ask any questions during the process. Don't hesitate. Don't wait till the end. You could ask me, jump right in anytime you want. Okay? Who has Medicare right now? Is anyone Medicare? Part A and B? Okay. What type of plan are you enrolled in? Supplement plan or Advantage plan? Supplement plans. Okay. All right. Good. That's fine. Who knows anything about Medicare? You probably do, because you're covered. Yeah, okay. We'll start with the book. We'll go to page 2. Medicare is I'm just going to read from the book. Medicare is a federal program, offers health insurance to American citizens and other eligible individuals. It's often called Original Medicare, Part A and Part B. You must live in the United States for 5 years in a row, including the 5 years just before applying for Medicare. You must be 65 or older, younger than 65 with a qualifying disability, or any age with diagnosis of end-stage renal disease. Medicare basically has 2 parts. You see the red, white, and blue card. The parts aren't listed on there, but that's what you get when you apply for Medicare and you get Medicare from the government. Okay, Medicare includes Part A and Part B. Part A covers hospital and skilled nursing care. Part B covers doctor's visits and outpatient care. That's from the government. That's the government plan. Generally speaking, well, really speaking, there is approximately a 20% deductible if you go just through Medicare. Okay. We got another guest. I'll give you a pen and a book. And your name? You need a pen? You're welcome. Okay. You can get more coverage than hospital and doctor's visits with Part D, which is a drug plan, prescription drug plan that you need to buy from an insurance company. It's not provided by the government. They subsidize part of it, but you have to buy it from a private insurance company. There's 2 ways to cover the deductible that I just mentioned. Medicare supplement insurance, which John and Naomi have, and then a Medicare Advantage plan, which is called Part C. Medicare supplement lets you go to any doctor you want in the country who accepts Medicare. It pays pretty much all of the out-of-pocket expenses not paid by Original Medicare. It covers all the items that Medicare covers, but it covers the out-of-pocket as well. What plan do you have, G or F or? Just for some conversation. It does, right? You have a deductible. Oh, you have a, okay. Some of the plans do have a deductible. Yeah. Yep. And they do. Medicare Advantage plans are called Part C, and what they basically do is take the place of Medicare Part A and B. Okay. A lot of the Part C plans have prescription drug coverage Part D included in the plan. It doesn't really replace Medicare A and B. You still have the right to have that coverage, but it covers all the expenses. It pays everything. And what happens is the company who issues the Parts C gets paid by Medicare annually. You know, some of the plans you don't pay any premium for, the Medicare Advantage plans. That's the benefit of an Advantage plan, is the premium compared to a supplement plan where you pay a premium. But the key benefit in a supplement plan is you go to any doctor anywhere in the country who accepts Medicare. Any questions so far?
Doctors
Excuse me?
with the Medicare, they.
Yes.
Go to certain.
It depends, yes. Right now, the new law that came out for 2026, there's a list, each company has a list of the doctors who are in the network. And I do all my business around this area. There's new answers in, and every doctor that I've come up across with my customers are in the network. By the way, I'm not only United Healthcare, I sell all the other companies as well. What happened is in 2025, the new law that came into effect covers everything, changed the whole business around. So I'm now involved with any company who sells Medicare in Connecticut, I do it, just so you know that. Any more questions, Laura? Oh, okay.
If you're already on Medicare.
Yeah.
And that comes out of your check,
Yes,
okay,
they can.
if you switch to a Medicare Advantage, are the payments coming out of your check, or how does that payment? start?
Well, 95,
I'm paying $100 something for Medicare right now, looking out of my Social Security.
exactly, yeah.
And if I switch to an Advantage plan, same thing happens, I still pay Medicare and they pay the Advantage plan, or how does that work?
Well, most of the Advantage plans that people purchase have no premium. And that's why they purchase them, basically. And there's no premium, so nothing else would come out with a no premium plan. Some plans have a premium that include extra dental coverage, or which you don't have
Like
now.
Coverage.
Exactly, eyeglass coverage, or eye exams, hearing aids, that kind of stuff, foot care. There might be a premium involved, but that you could go right through your checking account. That would not go through your Social Security check. The Part D premium, if you took just a Part D plan, that would be deducted from the Social Security. Because the government's involved in that.
The pros.
What are the pros and cons? The pros with your plan that you have now, is you can go to any doctor anywhere in the United States that accepts Medicare. The pros with the Advantage plan is zero premium. The negative is you need to stay in the network with network doctors to get coverage. Like I said, in this area, does everybody live in this area, Danbury or Bethel? Okay, then I haven't met one doctor who wasn't in the network. There's a couple in Ridgefield, but they actually joined recently. Did I answer your question, John?
Yes.
Good, okay.
Right, there are no premium. Medicare.
No premium? There is no premium. A lot of the plans are no premium. Now, I'm going to 2025. The 2026 plans, I can't talk about until after October 1st. That's the regulations. But I'm sure that there'll be plans at no premium for 2026. The government pays us, and we have contracts with the doctors that are involved on this plan. It's called an HMO, Health Maintenance Organization. And we pay them ourselves. So we negotiate with them on price, with the hospital and with the doctors. So we have an advantage over what they would normally charge at a Medicare rate. They would get paid from us less than that. And the government pays the company for the plan. Apparently, we do much better administration on these plans than the government does. So they pay for it. What are your coverage options? Page 4. Original Medicare, like I said, Part A, hospital, Part B, doctors. Second part of it is you can have Part A and Part B, and you could purchase a Part D in addition to that for the prescription drugs. Okay. The next one is Part A and Part B plus Medigap, which is Medicare supplement, which you guys have. And then the last part is Part A, Part B with the and Medigap. Most people, they buy a supplement plan, Medigap, they'll purchase a drug plan as well. Need to be covered for prescriptions, you know. Any other questions on that?
The next- yeah. For the prescription.
With Part D, you pay a copay. And it used to be, well, some of the plans have a deductible with it, and there's, the drugs in the plan are tiered. A tier 5 going down to tier 1, or tier 1 going down to 5. Tier 1 and 2 generally have no deductible. Tiers 3, 4, and 5, specialized drugs, brand name drugs, have a copay and a deductible. Depends who you're with.
No generic,
Generic is the way to go.
there's no generic.
But it really,
So
yeah, that happens. So things are going to change. You know, the out of pocket with the drug cost in 2025 is limited to $2,000. Once you go over that, there's no more copays. And that includes the premium that the deductible rather, that you're paying. So you keep an eye on that. You shouldn't be paying more than $2,000 if you're dealing with the same pharmacy. My situation is I dealt with 3 pharmacies this year, and each of them I don't know how I'm going to do this, but I got a lot of money coming back. I don't know who's going to give it to me. Yeah, good luck is right, I know. Okay. That's always more difficult. Okay, well, page 5. We're going to a Medicare Advantage plan, which is Part C. Many of these plans not only cover Part A and B, they have a Part D attached to them. And a lot of them with the Part D also have no premium for the prescriptions. Most people that I deal with in this area go to Medicare Advantage plan because of the no premium. But it all depends on your health, your budget, where your doctors are. I wouldn't enroll you in an Advantage plan unless you knew all that. There's a lot of facts I'd have to get to make sure it's the correct plan for your situation. Yeah. We'll skip to them. There's nothing else on that page that's important. So we'll go to page 6. What does Medicare cost? Medicare, well, I'll go to the next page after that. There are 4 kinds of payments you might have. You have a premium for the insurance, a deductible for certain items, certain services, certain prescriptions, a copay for prescriptions and certain services by the doctors or hospitals or skilled nurses, and you have coinsurance. Each Advantage plan pretty much has all 3 of these included. Your supplement plan has a deductible. Yeah, that's rare. I mean, but not. I think I know who you're with, but that's okay. I mean, you're paying a lower premium
Yes.
than you would pay without the deductible, which is okay. Any questions so far? Premium. Like always, you got to pay the government first. Part B has a premium monthly of $189 for 2025. For 2020, actually 2025, I think is over 190, maybe 198 for 2026. I don't know if they announced it yet, but you got to pay that no matter what. You got to pay the government first, like for everything else.
Sorry, could you repeat, you gotta pay them almost $200 a month?
You got to pay the government that, Medicare, to get Part B. To stay in, and you need to get Part B to get any type of other Medicare coverage. Like I said before, Medicare, basically their coverage is about a 20% deductible. Some of these plans, like the supplement plans, except for your plan, has no deductible. Okay. I'll go to page 8. Any questions, please stop me. Okay. When could you enroll in Medicare? Your initial enrollment period is 7 months long. That's the initial period. It includes your 65th birthday month plus 3 months before or 3 months after. You could apply when you're turning 65. That's initial enrollment period. If you receive Social Security or regular retirement board benefits, when you become eligible for Medicare, you'll automatically be enrolled in Part A and B. And if you're not, you need to go down to the Social Security office or go on the internet and apply there. But most of the time, you'll have Part A and B if you're collecting Social Security. The other times you could enroll, well, I'll go to, that's on the next page, so I'll stop with that. If you're eligible due to a disability, you have a 7-month period. Within the time you receive your 25th disability check, 3 months before or 3 months after. No questions? When can I change coverage? The next page, page 9. You probably heard of open enrollment, which is going to start on October 15th through December 7th. That means anyone who has Medicare Part A and B could enroll. There's no special birthday, there's no special time before or after. It's from October 15th to December 7th. And some of the plans for this year, based on the new law, they're going to extend that to December 31st. Depends on what kind of plan you're already in. So I don't know the exact situation, but what's going to happen with that, but I'll know more on October 1st. That's when we get the rollouts of all the plans. Yeah. Very important to review all your coverage choices every year. Things change, especially now, things are changing a lot. Consider your healthcare needs and your budget for the coming year. And make sure your coverage is changed based on your needs. If you come up with like a disease or certain sickness, you need coverage for that, make sure you got the coverage, which I would do if I sat down with you and reviewed what you are and how you are and what you want to have. You can make certain coverage changes from January 1 through March 31st. So if you're going to go from a Medicare Advantage plan back to original Medicare, like you have, you could do that from January 1 through 3/31. If you're going to go from a Medicare Advantage plan to a different Medicare Advantage plan, you could do that during that same period. What you can't do in that period is sign up for original Medicare. Questions on that? No? Good. We'll move on to the next page, page 10. What if I work past age 65? You have some decisions to make. If you have coverage through an employer plan or your spouse does and you're on the plan, certain decisions you need to make. Okay. You still have an initial enrollment period. Some employers require you to take full Medicare benefits Part A and B to stay on their plan. Not all do, but they'll notify you when you turn 65 that you need to get Medicare to supplement their plan. You can delay it if your employer has 20 or more employees. The employer provided health insurance is credible coverage. I haven't seen one policy from an employer, since I've been doing this, that hasn't been credible coverage. It's regular medical insurance. The employer does not require covered spouses to enroll in Medicare at age 65 in order to remain on the employer plan. The employee might have to, but the employee's spouse might not have to. Pay attention to the details. If you have a health savings account through your employer, you have to stop contributing once you enroll in Medicare Part A. Check with your employer plan benefits administrator before making any Medicare decisions. If you're covered by your employer, talk to them first before you make a decision. Sometimes it's better to stay on the employer plan than it is to go with Medicare. But from what I gather, the premiums are they're getting higher and higher through employers. And most employers have Medicare, they offer Medicare Advantage plans, which are HMOs, which have copays. So you have to weigh the difference between the Part B premium and what you're paying the company. But Part A, like I said, has no premium. Hospital has no premium. Part B has the $190 approximate premium every month. Questions? Good. How do I choose? Page 11. Answering the following questions can help you decide which coverage option best fits your health and lifestyle. I'm sorry, I didn't hear it, Laura.
Pick. Pick with- Pick with-
Well, some employees, when you turn 65, you can't stay on the plan. They want you to go on Medicare. Some employee plans want you to be on Medicare to cover some of the costs that the plan doesn't want to cover, because they know Medicare is there, that you could apply for it. It's all about money, like everything else. Important when you choose to, how often, your health is the most important thing. Most important thing is to stay healthy, or if you can't stay healthy through your plan. But how often do you go to the doctor? Do you have any health conditions? And what medications do you take? How much can you spend each month out of your budget? How comfortable would you be meeting your deductibles and copays or co-insurance, which would be explained to you at the time you enroll? Or you get a booklet that explains all the deductibles and all the copays. Okay. And how willing are you to accept the risk of high out-of-pocket costs? I have a plan I've been on, and the advantage plans have a gap of a certain amount of money. If you go over that in payments to the providers, you don't pay anymore after that, once you reach that limit. Now, last year, United Healthcare, the most popular plan, had $6,700 limit. Once you go over that, you pay nothing if you stay in the network. Remember, the advantage plans are network-based plans. You got to go to a network doctor. And it's my understanding that in 2026, every advantage plan are HMOs, which means you need to stay in the network. In fact, I just read an article when I was sitting here on the internet that each company selling in the country needs to provide Medicare, the government, a list of all the doctors that are in the network. And in the networks. That never happened before. Your preferences, which doctors and hospitals and pharmacies do you like to go to? I get asked this a lot in this area. How important is it for you to have access to healthcare when traveling? Medicare supplement does not cover you outside of the country. Medicare Advantage, some plans might, but the ones I'm aware of don't. Medicare Advantage only covers for emergency services outside the country. If you go within the country and you travel to another state and you need services, you still get emergency care without being in the network. And once you get care and you stay overnight, then you need to be in the network. Or else you're going to pay the whole fee. Any questions with that one? Excuse me? That's what I meant. Anywhere in the US, you got to make sure that the doctors that you see are in the network, but they'll cover emergency services anywhere in the country without having to stay in the network. Guess I'll go to page 12. Well, first thing you need to do to enroll is to enroll in original Medicare, Part A and B. And you could do that. Generally, it's age 65, 3 months before your birthday, the month of your birthday, and 3 months after your birthday. You can apply for Medicare Part A and Part B. If you're collecting Social Security, the government automatically, most cases, will give you Part A and B and start charging you for Part B out of your Social Security check. And there's additional coverage that are covered in the plans. Medicare Part D coverage is included in most Medicare Advantage plans. If you have a supplement plan, you need to take a separate Part D, which you probably have. Since you're paying for your
Yes.
brand name drugs, so you know that, right? Okay. Medicare supplement insurance helps pay some of the out-of-pocket costs not paid by original Medicare. Most that have a supplement plan purchase either Plan G or Plan N, which have very limited payments on those plans. The Plan N generally is a $20 copay for each doctor visit. The Plan G there's no copays. Option 2, Medicare Advantage plans. Combines original Medicare Part A and B in one plan. Part C overrides that coverage. Usually includes prescription drug coverage. And this is very important. The last item may offer additional benefits like vision and dental, I would say hearing aids, that are not covered by original Medicare. People don't realize that when they sign up for original Medicare, that they don't have, even on a supplement plan, like you guys have a supplement, you're not covered for a vision or dental. Not covered, unless you have cataract surgery or something like that, but the regular, like eyeglasses, not covered. Where the Advantage plans will give you an allowance every year for eye doctors in the network, eyeglasses, contact lenses in the network. For some people, it's a big advantage to have that. Especially me, I wear glasses. The last page is where you can learn more. Medicare, madeclear.com. You could call Medicare. There's a phone number here to call. They're very helpful. They answer the phone like most government agencies don't do. They'll call you back if they're busy. Social Security Administration, there's an office on, at least called Lake Avenue West in Danbury. There's an office there. And then there's a state health insurance program. There's a social service office in Danbury at 342 Main Street. Now, I'll go a little bit further. Is there any questions so far since you finished the book? Okay. Yep. Yep. You can. Doesn't cost anything. You can enroll in Part A. Yeah.
And then when
Well, when they want, basically, if they have a credible insurance coverage with the employer, then you could stop that and enroll at any time. But if you don't have insurance coverage through your employer, then you have to do it at 65, 3 months before, 3 months after. And Medicare Supplement also has an open enrollment period. It's 6 months after you turn 65. If you don't sign up after that time, you can't get underwritten, which gives the company an opportunity to cancel your coverage or to charge you a higher premium. I'll go into one other, excuse me, Kim.
Within 3 months of your birthday, and then enroll again when there's open enrollment?
No. Once you enroll in the plan, it automatically renews every year. You can enroll 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after. That's open time to enroll. Yeah. What most is not discussed in this book is what's called the Medicare Savings Program. Most people don't know about it. I'll explain it briefly. It's a state of Connecticut program, and most states have the program where you can get your Part B premiums paid for by the state. It's all based on income. I think for 2025, for a couple, the limit is $3,557 a month. If you make less than that, you can get the government to pay for your Part B premiums, which is $190 a month. I think it's 3,557. I can look it up, but I just looked it up for someone today. An individual, it's around $2,600 a month. If you make less than that, you're in good shape. Individual, about $2,600 a month. Once you get below that, you qualify for a Medicare savings program from the state of Connecticut, and they'll pay your Part B premium. That's why it's called Medicare Savings Program. It's all based on income, not assets, just income. Not if you own a home or you own another property, it doesn't count. It's only what you're bringing in. It's interest, dividends, salary, stuff like that. Most of I only sell in Connecticut, but most of the states have a Medicare savings program. If you Google it, they'll probably list all the states. Yep, and that doesn't cost anything to go into that program. But you need to qualify every year. They're going to send you a renewal application, and you got to fill it out, sign it, and send it in. Yeah, and they have ways to check on your income based on your tax return, and that's kind of, usually the first year they don't, but afterwards they probably, yeah. That's something that no one really, the state doesn't make you aware of that. They never heard of it, right? Yeah. That's why it's good to sit down with an agent when you're doing this stuff, because it's complicated. And if you don't, you're not told all the ins and outs, you'll never know. My job is to help you. I get more satisfaction out of helping you understand this and getting the right plan than making a commission. And I don't charge anything. If I want to sit down with you, I don't charge a fee. I'll just go through all the items with you and see the plan that best fits your needs. Excuse me? The company. The insurance company that issues the plan. Yeah, whichever one we go with. I have about 4 or 5 of them. Yeah. Yep. You don't pay a thing. Other than a premium, if you have a Medicare supplement plan or a separate Part D plan, is a premium. Sure. Like, yeah, generally there's co-pays on the Advantage plan. 2025, the zero premium Advantage, more of the Advantage plans from United Healthcare have no copay at all. Specialists, copay, $45. And you don't need a referral. But from what I understand, in 2026, you're going to need a referral from your primary care doctor. But right now, you don't need a referral. I don't know, but I haven't been introduced to the other plans yet. I just started hooking up with the other plans. So, like companies like Aetna, Anthem, Connecticut, Care Partners, Cigna. There's a lot of companies out there that do this. It is, but from what I know, United Healthcare is going to require referrals. I don't know about the other companies. I assume they will. I mean, your doctor, if you have a situation where you need specialized care, they should be able to hook you up and send a referral email over to the doctor you want to go to. And if they're in the network, there's no problem. And your plan, they should be able to do that. I mean, the doctor should be able to Well, you don't need a referral in Medicare supplement plan, no, you don't need a referral, just go to the doctor. Yeah, you don't need one in your plan. Yeah, well, it's not if you're in the network. Around here, it's not a pain in the neck. Believe I don't need referrals anymore. I'm in an Advantage plan with the United Healthcare. This year, no referrals. There used to be referrals necessary. Now, next year, there are going to be referrals. But if it's in like New Vance, you get a New Vance primary care doctor, he knows exactly where to go for cardiac services. He's going to recommend you to one doctor. And they do the whole thing. You don't have to do anything, but they'll make the appointment. That's it. Not hard, not difficult.
I have my.
On your plan, you wouldn't need a referral because you're paying a premium. So you need,
You work specific.
no, I just started. They changed the law around. The new, what do they call it? The healthy bill, whatever it is. And they changed all the Medicare stuff. So now I'm allowed, I could deal directly with United Healthcare and directly with a whole bunch of other companies. And I won't be able to sit down with you to discuss the 2026 plans until after October 1. Explaining them, I can't sign you up till after October 15th. And the plans will not be in effect until January 1st. If you want to make a Medicare Advantage plan now, supplement plan now, you could sign up now. You don't have, there's no open enrollment period for that. You don't have to wait for supplement. As long as you got Part A and B, you could sign up. But if you have an Advantage plan, you have to stay on that Advantage plan until the end of the year before you can cancel it and sign up for a supplement plan or go back to original Medicare.
So,
Sure.
no. Why people go to.
They do. It allows you to go to any doctor anywhere in the country that accepts Medicare, inside or outside of a network. Where the Advantage plans, you're in the network, you got to stay within the network. Yeah, most people that I interview and sit down with take Advantage plans, especially in this area. New Vance, all their doctors are in the network. And we check anyway. I'll check every doctor to make sure they're in the network for whatever company you apply to. And each company has different benefits. So it's an advantage to talk to someone that deals with a lot of different companies. Very few. Very few go from Advantage to supplemental. Well, you pay a premium. The average supplemental premium, I know for the Part G plan, a number of companies this year is $220 a month. You would have to pay that in addition to the $198 a month you pay in the government for Part B. And then you would need a separate drug plan that you have to pay for as well. And it doesn't cover, supplement does not cover dental, vision, or hearing aids. That's a big thing. Maybe they want to go to a doctor in Cleveland that is not in the network and they have a serious condition. Yeah, it's very rare that someone changes from an Advantage plan to a supplement plan. I mean, there's very good doctors in Connecticut. Most of the UL doctors are in the plan. Yep. Anyway, that's the whole thing. Any other questions at all? You could take, my business cards are up there. You could take one. If you have any questions, don't hesitate to call me. And if you want to set up a time to sit down, probably better to sit down after October 1, when I'm allowed to explain to you the 2026 plans. This I'd be happy to do. I haven't seen them yet. I know the supplement plans they go up every year.
Yes.
If the zero premium advantage plan, I haven't seen them going up at all. I'm doing this 8 years of Medicare, hasn't moved an inch from zero
On the top.
on the advantage. Supplements go up every year.
Is it because Advantage is so expensive that they don't need to go up every year?
No, they make money with no premium, zero premium, no. Advantage is not expensive. You pay co-pays. Like if you get an MRI, it's like, I think it's like $125 copay. Each night in hospital, this is a good one. Each night in hospital, in an Advantage plan, you might pay a copay of $500, let's say, for 4 nights or 5 nights only. Once you go over that, everything's covered in full. If you go in the hospital and have major surgery, major, and you're in there for 5 weeks, they're only going to charge you the $500 for 4 days or 5 days. That's it. That's what Advantage. Yeah. No, no pay. You don't pay. Generally, you don't pay anything. Okay. Each of the plans have have benefits, and some have disadvantages. Depends on where you're at financially, medically, what prescriptions you take. That's the key, you know. Advantage will go up, supplement to go up. No question about it. Yep. Supplemental plans? No, it's whatever the Medicare limits are. So, you know, some of the Medicare very rarely doesn't cover a procedure. I think I've come up with 2 in the last 8 years that were not covered by Medicare. They pretty much cover anything. And the supplement will almost cover everything. If you take the right plan, you get no copays. Your plan, you have a deductible. That's why you're paying less premium.
And, well, I guess it's kind of a.
Excuse me?
Here, that has.
I don't know about that. I've never come across a limit. Well, I could tell you something personal, but I don't like to talk about it, but I had a major surgery. And the first bill I got was $600,000. And I wound up paying for 4 nights in the hospital. An Advantage plan. And I wouldn't have paid anything if I was in the supplement plan. But not many people have that kind of a situation, so. Yeah. I hope I was right. Well, call me if you want to have an appointment. I'll sit down with you at your home, at a Dunkin' Donuts, at a Starbucks, or here, or anywhere you want me to sit down with you at. Some people even come over to my house for an appointment. I think that's about it. Make sure you have a pen, keep the pad, and call me with any questions.